When choosing healthcare coverage, there are many factors to consider, which makes choosing the right plan one of the most difficult and important decisions that a person can make. Joining us today with some tips on navigating the upcoming open enrollment season is Chief Consumer Officer at United Healthcare, Rebecca Madsen. Welcome, Rebecca.
Good morning.
Happy to have you here. So tell us, what do employees really need to know when selecting a healthcare plan during open enrollment season?
We know that people spend about 11 hours researching a car before they buy it, but 42% of people spend less than an hour researching health plans when they go into open enrollment. So the first and easiest thing people can do is just put a little bit of time aside. Look at changes. What's changed in the plans being offered to you, and what's changed in your own life. Are you sicker? Are you healthier? Have you had a baby? Don't just check a box and move on. Spend some time educating yourself on the plans available and what's changed. Another thing people can do is look at cost. Most people understand premium. That's the amount that comes out of your pocket and your paycheck for health insurance, but also look at deductible. That's the amount that you pay before your insurance kicks in. And then coverage. Make sure your providers are in the network. About a third of people don't spend the time to look and make sure their providers are in the network, and they can go out of network and get a big unwanted cost surprise. And do the same for your medications. Look at what you've taken and what your family's taken, and make sure it's covered on the plan that you're selecting.
So how can people maximize the value of their employer-sponsored benefits as well?
Well, there's a couple things people can do. First is look for wellness programs. You can put money in your pocket. There's a lot of financial incentives. 70% of employers offer them with an average savings of about $742 that you can get in financial incentives for doing things such as walking or taking a health risk assessment or getting coaching. So make sure you look for wellness programs to keep you healthy, but also as a way to maximize your benefits. Also look for specialty programs, dental and vision. They're often really inexpensive, and they can help not only your eyes and your teeth, but we know heart health is linked to oral health, so your dentist can see a lot by looking in your mouth. And you can also see by taking an eye exam things such as diabetes. And then lastly, health savings account. A lot of times people get confused by this, but it's a great option. You put money in tax-free, it accumulates interest tax-free, and you can take it out tax-free for qualified medical expenses. So it's a great opportunity to put some money aside.
I know that people want to make smarter choices when it comes to picking a plan. Are there resources available to help them do that?
People spend about 5 hours on their phone on average a day, and so spending the time, some of that time, looking through people. There's so many apps out there, but usually your employer or your insurance provider has a website. Look at the claims you incurred in the prior year and the medications you took. Compare healthcare costs for treatments you may receive in the upcoming year. That'll help you understand and pick the right plan for you and your family, and know how much money to put aside as well in a health savings account.
We talked a lot about employees, but what about employers? How can they support their employees through their benefit plans?
Employers, just like employees, should evaluate their plans and make sure they're meeting the needs of their population. They should look at the data on their employee base and see, for example, is there a prevalence of heart disease? Should they be offering a cardiovascular disease management program? Offering wellness programs like we talked about not only is good for the employee, but it reduces absenteeism. And specialty benefits, 80% of people say that they want it. But perhaps the most important thing they can do is communicate. Give people the time to understand, have forums either online or in the workplace to be able to help people through the process and take what may be complicated and give them information and tools to make it easier for them.
Perfect. Thank you so much, Rebecca. Real quick, what website should we go to for more information?
People can go to uhcopenenrollment.com. There's information, tips, there's a glossary of some of the basic terms we covered.
Okay.
And we hope that makes it easier for people. So thank you so much.
Thank you so much. And we'll be right back with more Midday Maryland.